Hello, my name is Marcos Borges and today to talk about disseminated coccidioidomycosis treated with interferon gamma and dupilumab. Definition. It is a fungal infection that spreads through the bloodstream and involves many organs. Disseminated coccidioidomycosis is caused by inhalation of fungal spores found in the cell regions. The infection spreads throughout the body and is especially common in immunosuppressed people. Antifungals can heal, but the death rate from this disease is very high.
Coccidioidomycosis, also known as valley fever, is a fungal disease caused by the Coccidioides species. This fungal species live in the soil of semi-arid regions. It is endemic in such areas as the southwestern United States, parts of Mexico, and South America. It is a reportable disease in states where the disease is endemic, such as California, New Mexico, Arizona, and Nevada. Of people who live in an endemic region, about 10 to 50% will have evidence of exposure to coccidioides. Most of the people who get the disease are people who live in or visit places where the fungus is in the soil. Many also engage in activities that expose them to dust. People get infected with coccidioides by inhaling fungal spores that become airborne after the disturbance of contaminated soil by humans or natural events such as dust storms. The infection is not spread from person to person or from animals to people. The infectious form of the fungus exists when the fungus grows in the environment. The fungus changes its form when it infects a person, and this form cannot be transmitted from one person to another. It is important to note, however, that coccidioides growing in culture as a mold in the laboratory may cause infection in laboratory personnel if the cultures are not handled properly and the appropriate precautions are not taken. About 60% of infections do not cause any symptoms. People who develop symptoms may experience a flu-like illness with fever, cough, headache, rash, and muscle aches. Most people make a full recovery within weeks to months of symptom onset, but a small number of people may develop chronic pulmonary infection or widespread disseminated infection. When the infection spreads outside of the lungs, it most commonly results in skin lesions, central nervous system infection, such as meningitis, and bone and joint infection. Some people are at increased risk for developing disseminated infection. People of African American, Asian, or Filipino descent appear to be at an increased risk, as do pregnant women during the third trimester and immunocompromised persons. Environmental testing can help identify when the fungal spores are present, and this can allow people to take extra precautions to avoid exposure to this fungal pathogen. To learn more about prevention and environmental testing services, please visit the website shown on the screen.
Applications in medicine. Resolution of infection is associated with robust interferon gamma mediated type 1 immune responses, which required the cytokine interleukin 12 for initiation. Accordingly, patients with monogenic defects along the interleukin 12 interferon gamma axis are susceptible to disseminated coccidioidomycosis. Its main symptoms are cough, fever, shaking chills, headache, muscular stiffness, muscle pains, stiffness or stiff shoulders, change in mental states, lead sensitivity.
Infection that's caused by a fungus called coccidioides. About 40% of people who are infected with it develop symptoms. Most commonly, they're flu-like symptoms like fever, cough, body aches, and fatigue. Some people can feel sick for weeks to months. And a smaller proportion of people can get very serious disease or even die if the fungus spreads from their lungs to other parts of the body, especially the lining of the brain, causing meningitis. Some of these people can be affected for years, even for life. It's also called valley fever because many of the first cases discovered in the U.S. were in people who lived in California's San Joaquin Valley, which is still one of the main areas that's affected by this disease. It's important to note that people get valley fever in many other places besides the San Joaquin Valley, especially southern Arizona cities like Phoenix and Tucson. The fungus Coccidioides lives in the environment, in soil and dust in certain places. In the United States, we know that these areas include Arizona, California, Nevada, New Mexico, Utah, Texas, and south central Washington state, but the fungus probably lives in other areas too. People become infected by breathing Coccidioides spores in the air. Symptoms from the infection usually begin 1 to 3 weeks later, and about 95% of people who get valley fever live in Arizona or California. The symptoms of valley fever can be the same as other conditions like bacterial pneumonia, so it can be difficult to diagnose sometimes. Lots of people get antibiotics for suspected bacterial infection before being diagnosed with valley fever. It's not possible to diagnose it based only on the symptoms. You need a lab test. Usually it's a blood test, but a doctor might take a sample of respiratory fluid or tissue for culture, depending on the part of the body that's affected. But cultures can take a long time to get a result, and even the blood test can take several days. Antibacterials won't make valley fever any better since it's caused by a fungus, not bacteria. And there can be side effects from taking antibacterials, things like rash, yeast infections, diarrhea, and severe allergic reactions. And of course, another concern for giving people unnecessary antibacterials is that it can promote resistance. For some people, the symptoms will go away on their own without treatment in a few weeks or months. It's not always clear if antifungal treatment makes symptoms better for the mild to moderate forms of coccidioidomycosis, but people who are at higher risk for developing the severe forms, like people with weakened immune systems, usually need prescription antifungal treatment, and people with severe infections always need antifungal treatment.
Pros and cons. Disseminated coccidioidomycosis causes serious iron with a prolonged disease course, permanent tissue damage, and a fatality rate exceeding 40%, despite modern medical and surgical treatments. The general support of good health limits the disease to a harmless lung disease. Prevention of AIDS or other causes of immune system disorders often prevents the most severe forms of the disease.
Its incidence is increasing. So people are infected by inhaling. Hello viewers, today's topic is valley fever. Before starting this topic, I would like to request you to subscribe this channel for more informative videos every day. Now the valley fever, whose medical name is Coccidioidomycosis, also known as California yellow fever, valley fever. Is a disease caused by a fungus, Coccidioides, which lives in the soil of relatively arid regions. Its incidence is increasing. So people are infected by inhaling dust contaminated with this fungus. Now, the fungus is not transmitted from person to person. So although most people infected with the fungus, this kind of fungus, have no symptoms. So if symptoms develop, they usually occur in the lung and initially resemble the flu and pneumonia like symptoms, like cough, fever, malaise, sputum production, and shortness of breath, excuse me. So some people are more susceptible to infection, like immunosuppressed people, so those who have HIV or cancer and pregnant females, and they may develop widespread disease, Our diagnosis is usually easy to accomplish, and disease can be treated by several antifungal medications. So there is no vaccine available for the valley fever, Thank you very much for watching this video, and please do not forget to subscribe. Visit our website, that's www.
Issue applied in Ecuador. In Ecuador, critical clinical cases have been determined in the province of Pichincha, Cotopaxi, and Tungurahua, and with all the limitations of the disease. It has spread throughout the inter-Andean regions, especially in the valleys if we take into account the climate factors and the characteristics of the soil of these valleys.
Valley fever is a disease that occurs when people are infected with the fungus Coccidioides. The way people get infected is that they inhale spores that are generated. Of course, it's critical to protect laboratory personnel.
So we wear two pairs of gloves. There's one inner pair that we put on in here, and we tuck the sleeves of the suits in and then tape it.
So we have a negative pressure room. The air is then filtered through a HEPA filter that catches any infectious particles. Additionally, everything is done inside a laminar flow hood where people are protected again by airflow.
I actually love it. I love working in the BSL-3. It took a while to warm up to, but it's really fun and it's rewarding work.
The diagnosis of disseminated coccidioidomycosis in two patients with discomfort should be considered: general fever, respiratory symptoms, and living or have traveled to endemic areas. His diagnosis can be established through serological, histopathological, microbiological studies. Treatment with the new antifungals must be considered and remains a challenge therapeutic, especially in the patients with HIV/AIDS infections.
Hi, welcome to the channel Health Point. If you have any questions, comment below and the team will answer you. And don't forget to subscribe.
What is valley fever? Valley fever is a disease caused by a fungus called Coccidioides. The fungi live in the soil of dry areas like the southwestern US. You get it from inhaling the spores of the fungus. The infection cannot spread from person to person. Anyone can get valley fever. But it's most common among older adults, especially those 60 and older. People who have recently moved to an area where it occurs are at highest risk for infection. Other people at higher risk include 1. Workers in jobs that expose them to soil dust. These include construction workers, agricultural workers, and military forces doing field training. 2. African Americans and Asians. 3. Women in their third trimester of pregnancy. 4. People with weak immune systems. Valley fever is often mild, with no symptoms. If you have symptoms, they may include a flu-like illness, with fever, cough, headache, rash, and muscle aches. Most people get better within several weeks or months. A small number of people may develop a chronic lung or widespread infection. Valley fever is diagnosed by testing your blood, other body fluids, or tissues. Many people with the acute infection get better without treatment. In some cases, doctors may prescribe antifungal drugs for acute infections. Severe infections require antifungal drugs.